Hello everyone, my name is Joshua Bear. I did an internship with Excella Health at Westmoreland Hospital. I'm with the Robert Morris University graduate program, the Health Services Administration. My internship lasted 4 weeks for 120 hours in total between June and July. This presentation will just be a summary of some of my projects, experiences, and application of my knowledge and skills. I chose Excella Health as my internship source for a variety of reasons, one of which was the fact that many people in my network, friends and family, do work with the organization, from nursing, their billing department, to their athletic training program. Another reason was that my focus is currently on patient safety and process improvement, and I was given the opportunity to work with their patient safety and medical outcomes department. They were willing at any point, if I felt that focus changing, to move me departments and preceptors as need be, and they were willing to educate me on any regulations, practices, or anything else that I needed to know throughout my internship. My preceptor during this time was Catherine Rosati. She's the Director of Patient Safety and Medical Outcomes. She's been with healthcare a great deal of time. She's currently getting her own master's and then moving towards her doctorate. Along with the standard objectives that Dr. Hampy gave us for our internship, with the exploration and experience of different departments, career opportunities, theories into practice, the application of knowledge that we'd gained throughout the program, and identifying challenges in healthcare, Excella Health also gave me a couple of their own objectives during this time period. This included an immersion-based role to gain as much experience and information as possible. They wanted me to gain a better understanding of patient safety and their practices, and they also wanted me to create a program or proposal for Excella Health. Because I don't have a clinical background, it was decided for part of my internship that I should become more aware of the various regulations and practices within healthcare, as well as having interactions and experiences with several departments in Excella Health. To that end, I learned about the MCARE Act, the definition of a serious event, and the creation of the Pennsylvania Patient Safety Authority and its intent. I also learned about the SLECAB prevention project that they had there at Excella Health that they had just recently implemented and had great success with. Because of that program, they had actually established a relationship with the Jewish Healthcare Foundation, and through that they had actually won the 2016 Fine Award. With that interaction, they also came to Westmoreland Hospital, and together with the Infection Control and Prevention Department and myself, we all did PPE observations. And I also got the opportunity to work with the Quality Department with a mock observation for quality within the quick draw facilities across Pennsylvania. And I also had the opportunity to interview Dan Robeson. He is the Director of Workplace Facilities at Excella Health and does all of the support systems there. One of my main projects during my time with Excella Health and my internship was the creation of the water management program. This was in response to CDC guidelines that were published this June. It was made in the prevention of Legionella bacteria in water systems and other waterborne pathogens. During the course of this project, I used a collection of skills and met a lot of the objectives that Excella had set out for me. First of all, it was estimated that 20 to 70% of all healthcare facilities have some form of Legionella in their water systems, and it has been on the rise. It is 4 times more likely since the year 2000. Because of this, there's a great need to inspect and identify issues within the water systems of a hospital or any healthcare facilities. For instance, with the issue with the VA in Pittsburgh, they had roughly 22 cases of Legionnaires and 6 deaths as a result. The average cost to treat Legionnaires itself is about $34,000. Lawsuits could average $225,000 or more, meaning that the VA ended up spending over $2 million with what had happened there. Because Westmoreland Hospital is an acute care facility, it does have a lot of patients that are at risk, those at risk being 45 years of age, smokers, men, and anyone who is immunocompromised. With the creation of the program, I did need access to plumbing information in order to create water flow diagrams, and to that end I contacted the Director of Workplace Facilities, Dan Robeson. Because Westmoreland Hospital is founded back in 1895, it has a single older plumbing system that can't be shut off at certain points. And because of various remodeling, they had dead legs, which are pipes that run off to nowhere that could be upwards of 50 feet in length. These act as ideal areas for the growth and spread of bacteria because of the stagnant water. From all the information I gained from Mr. Robeson, I did identify 19 critical points in the water system that could lead to the spread and growth of Legionella bacteria, as well as 14 prevention points in the water system to help take care of these issues. Their current water treatment system is that of copper-silver ionization, and it costs them roughly $60,000 to $100,000 per year. And the idea is with some of the newer systems there will be a cost savings as they cost roughly $50,000. Mr. Robeson and I also went over some of the CDC at-risk questions to identify how much danger Westmoreland Hospital might be in from Legionella bacteria. The three main questions that we thought were critical to this was that if we were a healthcare facility who had patients stay overnight or treat people who have chronic and acute medical problems or weakened immune systems. The second was that if the building had a centralized hot water system, and the last one was if we had a cooling tower, all of which were positive. Since we did identify we were an at-risk facility, I then started looking towards some of the different options we had as far as disinfectants were concerned for the water to keep Legionella at bay and removed from the water system. The two main ones were chlorine dioxide and monochloramines. Both are used within the public setting. Chlorine dioxide tends to be used more in healthcare, and the monochloramine tends to be used from municipal water sources. There is a lack of information on testing on both of these disinfectants, unfortunately, over long courses of time, and they both do have issues. Some being that they affect health of patients and the people that do ingest water in high concentrations. Due to the cost involved in some of the disinfectants, we did end up going with the chlorine dioxide. It had a much lower concentration and therefore a lower risk for the patients involved. Knowing what disinfectant I wanted to use for the prevention program, I then moved towards the actual preventative measures we could put in place. The first one was an annual superheat, where you heat the water in the hot water system to 160 degrees Fahrenheit, and this helps remove any bacteria in the hot water systems. We decided to do quarterly water testing at a variety of sources: municipal water heaters, water evaporators and condensers, and the cooling tower itself. We were going to do monthly inspections on ice machines, sinks, showers, in order to identify if there was a possibility of virilization of the bacteria, and to also check water pH levels to make sure they remained in safe levels for both the patient and for disinfectant use. I also put into place cold washer flushing procedures. Every month they would take time to flush the cold water system for 30 minutes to help remove water stagnation and any buildup that might be in the water itself. I also implemented a patient discharge protocol where after a patient was discharged from a room, they would take 5 minutes to flush the cold water as well. With putting a disinfectant in place, it was important to put a procedure in to monitor the concentration levels of the disinfectant in the water itself to make sure they didn't go over what was the EPA estimates and safe use, as well as chlorine dioxide, leaving what they considered residual chlorine in the water levels. With this, we were able to check some of the higher level plumbing because it is a single plumbing system, and upon finding any residual chlorine, we knew that bacteria was not present in the system, and if this level dropped, that it was either due to a plumbing issue or the fact that it was destroying some form of bacteria. With preventative measures in place, we moved out to outbreak conditions and protocols. Outbreak was considered if there was one or more cases of hospital-acquired Legionnaires with the patient 10 days within the facility prior to the onset, and 2 or more cases of hospital-acquired Legionnaires within 6 months if part of the 10 days was spent in the same facility. Outbreak protocols included the shutdown of any suspected system that could aerosolize water, putting patients at risk, and cleaning and disinfecting them. We also would do a superheat to heat the hot water to remove any bacteria that might be present. If the cooling tower itself had been positively identified as a carrier, it could aerosolize the water and bacteria to various areas outside of the hospital, and we would also need to check any external air intake air conditioners and make sure they were disinfected so it couldn't further spread it. We also included measures to check any patients who had hospital-acquired pneumonia with the standard Legionella and Legionnaires protocols so that they get anti-Legionnaires antibiotics as quickly as possible. With protocols in place, I then moved towards task sheets to make sure that any preventative measures were done in a timely fashion and the data was recorded as far as information and timetables went. With this, I created a compiler with all this information to show any problem areas that might exist, as well as verification and validation of the program. Below are a few samples of some of the additional work I did do for the program. Included is the disinfectant concentration checklist, as well as an observation water flow diagram to help identify areas of observation and control points. During my internship, I was also given the opportunity to take part in RCA for the epinephrine drug. We had an issue where a patient was given the drug IV instead of IM, resulting in a wrong route event. With this, we also learned that there had been an earlier issue a few months ago where a patient had been given incorrect concentration of the drug, and from the Patient Safety Authority, we found out that this had not been an isolated occurrence among just our hospital. To that end, we decided to start taking a look at some of the practices that were currently in place. We hadn't had any issues with epi errors for quite some time, since 2012, and it was because during that time we had an event and did a large amount of education. Westmoreland Hospital didn't have any issues with epi since 2012 due to an event that had occurred, and had educated their staff on issues with the drug itself. With that in mind, we used the 5 Whys, and we noticed that 60 to 70% of the ED nurses currently in place were new hires from the last couple of years. With that in mind, we decided to put more education back out in order to educate these new hires. We put a biannual newsletter, information on epi, and we decided to create a sign on the emergency allergen box that showed the difference between the IV and IM route medications. An opportunity to work with the quality department arose during my internship as well, and I was able to take place with a mock medical quality observation in the quick draw locations in West Newton, Jeanette, Harrison City, and Greensburg. We noticed during our time there that most of the issues involved reporting posters, as well as one of the culture tubes that expired prior to the other one expiring. We also identified many of the good practices they had there at those locations, including patient ID methods, self-sticking protocols, emergency response protocols, and hygiene protocols. I noticed during this project there was a lot of attention to detail as far as expiration dates on medications, drugs, tubes, hygiene practices, as well as emergency practices. During the course of my internship with Excel, I did meet the objectives that have been put forth by RMU as well as Excel Health itself. I got a lot of hands-on experience with the various departments I did work with, as well as understanding some of the opportunities I could have there. I put a lot of my theories that I'd learned at RMU into practice, such as the 5 Whys during the RCA event, as well as the proposal and creation of the water management program. I explored some of the career options available to me from my understanding and interactions with those departments, and I applied the knowledge I had gained in finance and the efficient use of resources with the water management program, its research, measurements, verification, validation methods, financed with the treatment of Legionnaires, as well as the disinfectant costs of the current system and new systems, and resource use with team building, task assignment, and employee input measurements. I was also able to identify the various challenges, complexities, and barriers that are within the healthcare system itself due to my experiences during my internship, and I demonstrated various leadership skills with the creation of the water management program, being proactive in its creation, as well as the various methods I needed to gain information and create the measurements and procedures that needed to be put into place. For the objectives that have been set by Excella Health, I spent a great deal of time in some of the various departments that were within the hospital. I gained a better understanding of patient safety through some of the regulations, reporting methods, and meetings that have been put in place. And I obviously learned a great deal about program and policy creation with the water management program, as well as the creation of the data compiler for verification and validation of the program. I'm extremely grateful for the opportunity I was given with Excella Health during this internship and the knowledge that was gained, as well as the application of my own skills and understandings. Between working with the various departments with interviews, meetings, telemedicine, finance, gap analysis, and other activities, I've gained a much greater understanding of healthcare administration, as well as some of the opportunities available to me.